Today I'm going to be interviewing a very special lady. Her name is Moira Bradfield. She specializes in the vaginal microbiome, which is something that's very specific and quite unknown to most of us. So I hope you enjoy our chat. Thanks for joining me here today, Moira. I really appreciate you coming on. I've been following you for a little while with your intimate ecology and the vagversity that you've gotten up and going. So how did you get to specialize in this field? Like, it's very specific what you do.
Yeah, it sort of evolved, I guess. I'd been a clinician for many years and then had a run of people with vaginal health conditions and found that they were frustrating in that interventions I thought should work weren't working. And then I went back to the drawing board in terms of finding out what I didn't know about the space and realized that there'd sort of been a huge leap forward in understanding the vaginal microbiome. Essentially, we had no concept of that. At least we didn't when I trained 20 odd years ago. And so I really threw myself into that and learning as much as I could. And the more I learned, the more it spread out. And really, I started to see more and more people clinically when word got around that that's what I was working with. And from there, it evolved again into me then going and pursuing further studies, essentially doing a PhD looking at recurrent thrush, because I found that clinically was more challenging than any other vaginal health condition that I had been exposed to. And yeah, it's sort of, that's why I'm here and doing what I do.
Yeah, I think it's really great because I feel like there's a lot of knowledge and information out there for men with, erectile dysfunction and everything that's going on for them. But I feel a lot of women coming into the clinic and young girls feel a lot of shame and shyness about talking about their intimate parts. So it's really wonderful that you've opened up this space where women can go and feel comfortable talking about what's going on for them. So first of all, I just wanted to ask, is the gut microbiome connected to the vaginal microbiome? Like, do they really affect each other, or is this something that's separate?
They're connected in the sense that they are two microbiomes existing within a single person. And the importance of the gut microbiome is obviously fundamental to well-being and immune health and hormonal health and all of those sort of things that we think about clinically. But if we're looking at it as specifically the microbes that exist in one site to the other, they're very different. And you can't look at a gut microbiome and predict anything about the vaginal microbiome or vice versa. So the gut microbiome, there's, obviously there's huge variations and thousands and thousands and thousands of different bacteria or fungi or archaea that can exist within that gut microbiome. And when we're looking at health, the basic premise is we need diversity in that space. We need lots of different types of bacteria predominantly, whereas in the vaginal microbiome, low diversity is a hallmark of health. And we know that there are quite specific bacterial groups that we look for to define a healthier microbiome, with lactobacillus being the primary one that we focus on. So those two things make it very separate. And then I think there are a whole lot of quite pervasive folklore, almost myths around, translocation from one site to the other. And it's not that that doesn't go on. It's more that it perhaps doesn't go on as much as we think, and that in health, the vaginal microbiome is a pretty robust and defended space by its beneficial bacteria. And then having things like candida in the vagina doesn't mean you have it anywhere else in your body. In fact, to say that that means you have it in your gut is a very big jump, in that there's no one apart from our research, which hasn't been published yet, that looks at whether those two things are coexisting in both sites in people that have issues with them. And the existence of a fungal microbiome, or what we call the microbiome, in both the gut and the vagina is not a given. There's lots of people that don't even have that, in either space. And so it's complex in that, as a health practitioner working in holistic health, of course they're related. I wouldn't dream of addressing the vaginal microbiome without knowing about somebody's bowel habits and digestion and diet and nutrient status, and how that could be impacting other aspects of their life. But at the same time, I wouldn't just ask about the gut to understand the vagina.
So what other things would you be looking at, because that's interesting. Because when a client comes to me and they've had chronic candida for over a year or two, and they've cut out all the offending foods that they've researched about, and also taken the herbal treatment, and it's still not disappearing, what other things would you say are going on for them?
Yeah, I mean, because those approaches for vaginal candidiasis don't work.
Mm.
I mean, eating a great diet, of course, take out the crap and keep better hours and don't drink alcohol and don't binge on, sugars. Those are fairly basic premises for good health in general, not just for vaginal health. And but the bigger picture in vaginal health is nutrient status, definitely mucosal immunity, what that means in terms of how that's contributed to by the health of the tissues within that area, and also what exists on them. And the health of the tissues is influenced by hormonal status. So for people that have vaginas, hormonal rhythms are a really important thing to understand. Or if people are in different stages of their hormonal life, what that can mean in terms of changes within the vaginal microbiome itself. So those are bigger influences potentially than any of that dietary stuff. And likewise, thinking about the nervous system state is important, and thinking about sexual partners. This is a piece of anatomy that has a direct interface with the external world for a majority of people, and therefore has the potential to be exposed to a whole lot of challenging influences that, when a microbiome is challenged, become even more problematic and hard to pull that person back from. So, it is still an integrated and systemic approach to overall well-being. Like, again, it's not to isolate this piece of anatomy and only think about it as a vagina. It exists within the person. There are hormonal influences, nervous system influences, stage of life influences, metabolic influences, and of course, as we've talked about, digestive impacts as well. But, you have to sort of think about that on the flip. What happens when those things go out of whack? How does the microbiome in the vagina change, or how does the tissue integrity in the vagina change? And then can we assess that person's external environment as well for potential disruptors that are making it harder for that baseline to be found again in terms of balance.
So really looking at it in terms of a holistic approach is still very important, instead of just isolating that particular part of the body as the problem. Yeah, that's great. And what sort of hormones would you be looking at for somebody that has symptoms as candida or bacterial vaginosis? Is it all to do with estrogen? Is it more to do with the pH? Can you expand on that a little bit more?
Yeah, so the primary hormone that has an influence on this space is estrogen. And estrogen, in a sense, because having a predictable, healthy estrogen level over the course of a cycle or at different stages of life directly correlates to the health of the cells within the vagina and how much fuel they express for beneficial bacteria to exist and multiply on. And so those two things are intrinsically connected. And if you don't have the fuel or the feed essentially for lactobacillus bacteria, if we take that generalization, then things will shift and the pH will become elevated. So within health, the pH within the vagina, which is a very big regulator of the immune system and the homeostasis and how much defense you have against, interacting with the environment, those bacteria, those lactobacillus bacteria, are the regulators of that. And so if you don't have an environment, or if we use that analogy of having, great soil in a field, then you're not going to be able to support that particular colony of bacteria, and they're not going to be able to protect you against things. And so estrogen plays that really important role, particularly with the bacterial environment. When we think about the fungal environment, it's a little bit more complex, because we want good estrogen stimulus to have that beneficial bacteria, which is the basis of most people's microbiomes. They have a whole lot of bacteria and maybe they have some fungus. But when it comes to species like candida, if you have excessive amounts of estrogen, or if you have relative excesses unopposed to a good, progesterone level, for example, then you have an overabundance of fuel that can also create imbalance and feed candida species. And so we see in people's cycles that often they'll have a higher risk of a thrush flare at ovulation or mid-luteal, in that second part of the cycle. And when we look at very basic graphs of estrogen as compared to progesterone, there are two peaks that coexist there, that where those things elevate. And so the fuel elevates, but behavior also changes around those times. If you are sexually active, you might be more inclined to have sex because of that hormonal rhythm as well. So those things go on for people. And then with candida also, because candida can be problematic in a perfect bacterial environment, and it can be problematic when the bacteria is challenged and the pH is challenged, so that it behaves differently for different people. And if we're finding candida to be problematic or thrush to be more problematic, and we're consistently being told that the pH is great or the bacterial environment, there's nothing wrong with that, then we sort of need to dig deeper into maybe hormonal rhythms, maybe hypersensitivity responses. So we know that people that have hay fever or allergic rhinitis are more prone to having recurrent forms of candida.
Interesting.
Yeah, so it's a little bit like the hay fever of the vagina. And so you look at it from that perspective as well, is how can I think about histamine in a bigger, more integrated concept, or how can I down-regulate inflammatory responses and support an immune system to respond appropriately, but not in excess at different points of a cycle as triggered by hormones a lot of the time.
Very interesting. So again, it's really treating it like you would any other part of the body when you're trying to down-regulate that inflammatory process and still supporting the immune system. That's really interesting because people tend to look at it as something that's totally separate from the part of the body. I guess there's so much unknown about how it all works and what influences it. Interesting. And what about bacterial vaginosis? Would you say that's more of a bacteria-driven condition or something that's more influenced by the pH, hormones?
Yeah, so I mean, it depends again on the person and their stage of life, but the definition of bacterial vaginosis or BV is a loss of lactobacillus and an overgrowth of anaerobic bacteria. And the reasons that can happen are varied. So hormones, definitely. We see a higher risk of BV when people's estrogen is lower. So just before menstruation, just after menstruation, during breastfeeding, when people don't necessarily have a cycle and their hormonal balance is different, or as they approach perimenopause and menopause, it may also become more pronounced. So that stimulus that supports the beneficial bacteria and allows them to hold the microbiome becomes dysregulated. And so we see pH shifts, we see more opportunity for bacteria that can exist in a higher pH environment, then, contribute to that presentation. So there is always a hormonal pattern. And then with BV, particularly things that are external that could be pH disruptive. So when we think about that, we could be, ejaculate from a partner or saliva from a partner, or it could be douching practices or swimming. Some people's vaginas will take in water when they swim, and that can be disruptive. Or using hygiene products that are not conducive to supporting the microbiome. All of those things can also be disruptive, just like menstrual blood. Sometimes people report that they'll have BV type symptoms after menstruation. Depending on the length of your bleed, you may have just had 4 to 7 days of a non-acidic fluid exiting your body, and that's very challenging to that space as well if you already have a tendency to imbalance. So BV is again complex and very specific to the individual. And I think clinically what I have learned over time is that you can't just think about these as microbial conditions, because that's not root cause at all. That's not holistic. That is why we run into so much recurrence. Sure, you can kill a bacteria or reduce it with a specific intervention, but if you don't address the reason why that environment was challenged in the first place, whether that's hormones or external influences, partner contributions, or even partner, input of new bacteria or new fungal species, then you're not going to get traction on being able to recover from it.
Yeah, and in terms of when you speak with partners, do you think it's important to always address the other partner's health in regards to the person recovering from BV or candida?
Yeah, if it's complex, but typically if they're a regular partner who is generally engaging in unprotected sex, then I think that addressing the partner on some level makes recovery more straightforward. We know, for example, for people that have partners that have penises, that they harbor a whole lot of bacteria that can be contributing to an onset of BV. We have a seminal microbiome, there's a penile microbiome. There's differences in the microbiome on a foreskin, whether somebody has one or not. And so there are studies that show us that you can predict, well, a particular study, they predicted the onset of BV in female partners by looking at the penile microbiome of male partners. And so there's very direct cause and effect there. And so if you're stuck in a cycle and treatment is failing, then in a holistic sense, I think it's very much worth exploring that. But the sexual trigger part is very different for other people. Some people will have a very definitive time point. They're like, this is when everything changed. It was this new partner and everything spiraled from there. Or I only get symptoms if I have sex, in which case exploring the why of that is very important. And it might be partner contribution of microbes. It might be pH disruption. It might be inadequate lubrication leading to tissue trauma, and therefore your microbiome is challenged because there's more inflammation in there. In terms of just being ready, or people having obligatory sex and not really being in it in the moment. There's those sorts of things that could create more risk for an individual. Well, so it's very complex, but in terms of, if people have a regular partner and it's an unprotected sex relationship, whether they're same sex or opposite sex, I think it's important to assess and make decisions around that as well.
It's interesting, very interesting topic, because the current culture of sex today seems to be a lot more open. I see a lot of women not using contraceptives and being quite comfortable with it, or so using protection and more using a contraceptive as a form of not getting pregnant, and then they forget about using sexual protection with intercourse. So how do you think this would be affecting the microbiome long term, being exposed to so many different seminal fluids, different partners? What do you think that's going to have impacting on our future?
Yeah, I think it's an interesting discussion. I mean, I'm from a generation where safe sex was very much drummed into us because of fears around HIV in the early 80s and 90s. And when I sit in clinic, because I have a very busy clinic, and one of the reasons that I have a very busy clinic, in my opinion, is because of exposures. And I'm completely okay with people having any type of sex that brings them pleasure and having as many partners as they need to. But at the same time, having seen the extreme repercussions of that, and granted, it's not everybody's repercussion, but having seen the worst case scenarios of people having an exposure and having a never been well since event, or, having this more blasé attitude to the fact that the majority of STIs these days are treatable, but it doesn't necessarily mean that your microbiome will recover. And we know from STIs like chlamydia, for example, they can be quite devastating. It doesn't matter how long you've had it, and a lot of the time they are asymptomatic, but they can be quite devastating to this particular microbiome and will have changes that may not be recoverable. And it doesn't mean you can't find good health again, but it can be one factor in it. And the fact that we do acquire and interact with different bacteria that are not STIs, but they can still be problematic for our microbiomes, means that I am very cautious around that, and, quite worried in that pervasive thing, because it seems to be that we've forgotten what the impact of these things are, because they are treatable infections, and there's heaps of prep out there in terms of preventative prophylaxis with HIV. And what that means is this, different culture around sexual intercourse, but quite challenging, particularly for the vaginal microbiome. And, when I talk to people and they're like, oh yeah, my partner tells me that their last girlfriend or partner had problems with thrush or had problems with BV, and then we're seeing this in this new person, then I think that that's something that we should be looking at in terms of why are the recurrence rates of these conditions quite high now, higher than we've ever seen before, and perhaps standard interventions are not working as effectively as they used to as well. Yeah.
And can those changes in the microbiome, can that affect fertility long term?
It depends on a whole lot of factors. Again, microbe-specific bacteria in particular. There's definitely literature that suggests that having a lactobacillus-dominated vaginal microbiome is more conducive to conception, is more conducive to lower risk pregnancies. So those are big things to be thinking about as well. And then with STIs in generally, particularly ones that can remain undetected for long periods of time, that can have impacts on in terms of the pelvic inflammatory disease and how good your fallopian tubes are essentially, and whether they have scar tissue in them and things. So they are bigger things and perhaps scarier things to think about. And I want to say that's not everyone's experience, obviously. I mean, and my clinical privilege is that I see that more commonly because I'm dealing with complex cases. But it is pause for thought. What does this mean? And why am I making that decision to have unprotected sex with those people when I could enforce a barrier method, whether that's a condom or a vaginal dam or, latex underwear, and still enjoy the pleasure of casual interactions or whatever it is that defines how you exist in that sexual pleasure world, but by minimizing the risk of some of these microbial influences.
Yes. Yeah, it's interesting. Lack of thought, lack of responsibility, lack of interest in the future, I guess, and how it affects our health. Interesting. And just going over to the other spectrum with women going through menopause that are still wanting to be sexually active, struggling a bit with libido, actually wanting to be engaged. How is that affected by the microbiome, or is that something more hormonally? Because some women, they come and they feel like it's more localized, so that vaginal dryness is affecting them wanting to engage, or is it something a little bit more to do with hormones driving that?
There's always two directions, but predominantly it's still a hormonal condition. We have in perimenopause both highs and lows of estrogen, which can create a bit of havoc in that transition from having vaginal atrophy and dryness, which means typically that there will be shifts in the microbiome, so more tendencies to BV or acute infections, including UTI. And then potentially if they're experiencing very big highs, unopposed highs of estrogen, there might be more risk of candida or thrush type presentations as well. So it is variable and can change from 1 month to the next, whether ovulation is predictable, what's the length between those. And then as we move into, past the menopause and post-menopause, where estrogen is typically lower for the predominance of people, that influence on vaginal tissues can create a whole lot of barriers, physical and emotional and nervous system, where, there's hesitancy, which means that there might be tighter pelvic floor, and that might create more risk of tissue trauma. There is, perhaps a whole lot of stuff that goes on around, the yeses and the nos, and how prepared are you, and are you willing to use a lubricant or not, because your lubricants become very important. They're important at any age, in my opinion, but they're more important perhaps as that hormonal fluctuation starts to happen as well. And so, addressing hormones or considering hormones can often see you have better response to, not having those symptoms occur and have more stability within the vaginal microbiome, to the point where, for people that have recurrent UTIs, now guidelines are changing where vaginal or topical estrogens should be first-line therapy for that. And sometimes in those complex cases, that is life-changing for people to estrogenize the area, because it does support a microbiome, because the estrogen is there to feed the bacteria or to feed the cells that feed the bacteria. So yeah, it is hormonal. It's not an isolated piece of anatomy. It might be dry and the tissue trauma is there, but that's in direct response to what's going on with hormones. We see tissue changes in any part of our body. Our skin changes on our face when we are going through a transition with estrogen. And just like we would our face to prevent aging, we should moisturize. So
Interesting. Yeah.
moisturizing the vaginal canal is an important thing to be thinking about, and that can be lubricant for intercourse, but also daily moisturizing. We have guidelines that suggest vaginal moisturizers are just as important for some people as using an estrogen would be, because it is about keeping those cells, supple and having moisture in the right place with them. So those sorts of things can be somewhat preventative, and certainly looking in a holistic sense, looking at diet and looking at tissue and cell health with vitamins and what's going on with estrogen levels, and can we support that for as long as possible. Yeah, but it is very much still a hormonal situation. Lay it in with, if you are having sex, what's going on there, and where's your nervous system, and willingness and worry around that as well.
Yeah. And in terms of the lubricant, because I do get females that feel like they've tried every lubricant and it seems to actually induce the symptoms that they're having, is there any specific guidelines that you would have around that? Like what sort of lubricants and moisturizers to use that don't bring on the symptoms?
I mean, it depends on the individual again and what symptoms they're experiencing. The basic guidelines around vaginal lubricants are that they need to be pH correct. And there's a thing they call osmolarity, which is the movement of fluids in and out of a space. And so they need to be osmolar correct as well. And so usually that falls into this category of water-based lubricants. They can't, you measure pH in a solution that has hydrogen ions, which is what water is. And so for a majority of people that still have a cycle of water-based lubricant will be appropriate. And there are lots of them now on the market that are exceeding expectations, that are very gentle. I tend to say keep it neutral. You don't need flavors. There doesn't need to be bells and whistles around it. Purely a nice slippery water-based lubricant. Sometimes with menopause and the increased need for the moisturization, then an oil-based lubricant can be better tolerated and it has more staying power. The considerations around oil-based lubricants, however, are that they're not compatible with barrier methods. And so if the partnership is more casual, it may not be an appropriate intervention to be looking at. But otherwise, it's generally better tolerated and less likely to trigger symptoms if the lubricant doesn't need to be reapplied as frequently and sticks around for longer and can really minimize that friction-based trigger on the tissues themselves.
Okay. What about things like if they were to be really simple and use something like coconut oil because they think that it's also antibacterial, would that be appropriate for them in terms of an oil base? Because I do get females just using coconut oil.
I'd want to know how they respond to it. Did it make anything better? And in my experience, for people that would have BV patterns, it's not the best match. So we know, again, with oils that sometimes they're trickier and they hang around for longer. And so with the BV pattern, it can be a little bit disruptive. Some people swear by it. I tend to veer away from it in clinic as a recommendation. But if it's working for people and it's not triggering symptoms, I don't necessarily remove it from them, other than that consideration, again, of an oil-based barrier method compatibility and what that might mean for them as well.
What are the top 5 things that you think a woman could do to increase her vaginal health?
Well, gosh, there's more
It's a big question, isn't it?
Drink water would probably be a primary one.
Okay, yes. Keep hydrated.
Yeah, keep hydrated. I think understand your hormones, and if you are experiencing vaginal symptoms, where that might be occurring in relation to a hormonal rhythm. If you have a cycle, what's going on and where that's happening. In my opinion, barrier methods, if you are engaging in sex and and it's causing symptoms, then a barrier method is a must-have in there and protective of microbiome challenges. The other thing, if you have any concerns, get it tested. I don't guess, the fact that thrush is not the most common vaginal presentation in clinical practice, yet it is the thing that people will identify most commonly being the cause of their symptoms, is a really big thing to be understanding of. Just because there's irritation doesn't mean it's fungal in nature. So getting a swab and having a discussion, which seem like they might be very scary things if you're not comfortable talking about them to others, but just, do it, get that testing done and see what's happening. And, if you're not getting answers, keep exploring that a little bit further. I mentioned obviously good diet, and I think that is important as well. If you have very specific things that you are noticing trigger symptoms, then, explore that. And clinically, I know things like wine, for example, is a very big symptom triggerer for people, and for a variety of reasons. But generally, most of us can do without it. Like, we don't need that in our lives.
Yeah, for sure.
And likewise, just cleaning up your diet and making sure you've got lots of nutrient input and that's all coming in. I think we're at 5, are we?
I think so, yes. Thank you. In terms of IUDs, because I do get the question with females that have IUDs with recurrent BV, just wondering if they should take it out. Do you think that could be affecting their symptoms, having a foreign body in there?
So we do have literature that tells us that when there's an IUD, there is a microbiome shift that occurs. And so granted, not everyone with an IUD has BV recurrence, but if it's happening, then you need to consider what that IUD constitutes. But at the same time, it's not practical to tell everybody to have them removed. People have contraception like that for so many reasons, and it's not always just to prevent pregnancy, obviously. But if there are hormonal reasons or bleeding reasons, those are all very big influences, obviously, on the vaginal microbiome as well. So, I do work with people with IUDs in situ, and people have the decision. Obviously, it's their decision. I can't make it for them. We discuss it in the context of what's going on with your vaginal health. If it's all happened since you've had an IUD, obviously that's perhaps a bigger thing to explore as well. Being in there, it can be a little bit of a totem pole for bacteria and fungi to adhere to and continue to be a disruptor of the environment. And if they're choosing to, work on it with it in place, then we just choose strategies that are in alignment with that as well, and make a decision that we'll review. And if things aren't changing, then perhaps we need to circle back around to that discussion around what is the role of your IUD and what type of IUD and all of those other things as well that could be impacting that presentation.
So a lot of women get concerned that they have different smells that change over the period of their cycle. Sometimes they feel like it's around their menstrual cycle that it becomes a little bit offensive. So GPs tell them that this is normal. What do you think?
I think it represents a bacterial shift. Whether that is normal or not is dependent on a whole lot of factors. So usually odor is produced by quite specific bacteria. We have BV-associated bacteria that produce odors that are more in alignment with being called fishy. And then we have aerobic bacteria that have odors that are more sort of pungent or foul or a little bit off, but very hard to pinpoint what the odor is like. And both of those bacteria groups will proliferate or get higher when estrogen drops. So again, around moving into a menstrual cycle or coming out of a menstrual cycle. And as we discussed previously with the blood itself of a bleed, then that can also influence that microbiome. So there's two things. One is that if it's offensive and prolonged, then it needs to be addressed. And if it's a new symptom, then in my opinion, even if it's not showing up as an infection, there's a lot you can do to support that and change that presentation. The other is that if it's, not resolving and then it goes on and there's a gushy discharge or there's more pronounced, then definitely that needs addressing as well. But looking at when it happened, when did it onset, again, with menstrual blood, sometimes people report quite foul odors with menstrual blood. That is not necessarily every cycle. All of that is still representative of microbiome change. And so there's this sort of spectrum of change that then the microbiome recovers. As soon as estrogen back, it gets back on top of it. And it's like, oh, okay, we've got it sorted. We're back in alignment again. But it does still give us an indication that that microbiome is struggling when it encounters a hormonal shift or it encounters a pH challenge. And so it's worth looking at. I mean, potentially those are the same people that would, may engage in some body fluid exchange, like ejaculative sex, and go, oh, I notice I'm a little bit odorous the day after, and then it recovers again. So it's a similar situation. A pH challenges the microbiome. It loses control a little bit. We have a growth of bacteria that can produce odor, and then potentially the microbiome gets on top of it and recovers it once the stimulus is removed. So as a holistic profession, I would like, let's throw some support at it. It wouldn't potentially be as aggressive support as if somebody is having quite specific, infection symptoms and discharge changes and inflammation or color changes to their discharge, but it's still necessary. And then to step back and look at that hormonal picture as well, what's going on there, why is that challenged at that point, and what are your behaviors around that as well.
And what sort of support measures would you be thinking of putting into place?
Yeah, I mean, it varies. So very basic things that sometimes, and it's very rare that people, it fixes everything. Might be some quite specific vaginal probiotic strains. So and looking at that, sort of putting them in place to support the microbiome so it can get itself sorted again. They don't colonize, and they don't, you don't use them so that you get a magical new vaginal microbiome. You still have to think about feeding your own bacteria in that space. And still, around that, what is that hormonal change pattern, and do we need to support progesterone more effectively? Do we need to look at the relationship with estrogen and progesterone at that time? Is there a whole lot of PMS type stuff that tells us there is hormonal change occurring that perhaps we could smooth out a little bit, and that would mean that the microbiome isn't, as jaggedy in terms of how it's stimulated by its hormonal stimulus as well.
So hormones are definitely a big part of how the vagina operates in terms of fluids, smell, menstrual cycle, bacteria. So would you say that looking at a person's stress response then is important in managing symptoms as well?
Oh yeah, definitely. I mean, we have a quite defined understanding that people who have recurrent symptoms have much higher stress loads in general because of the symptoms themselves, but also that stress and cortisol, or like adrenal adaptation issues, predispose them to vaginal imbalances as well, or dysbiosis, like we see with other microbiome sites. And so it's about acknowledging the load of stress and what that means for us as humans. Typically our diets go out of whack, our rest changes, what we do on a day-to-day basis in terms of self-care is compromised. And then we also know that if we have symptoms, people stigmatize themselves. There's this whole societal push around perhaps not talking about it or shaming if there's odor, and what that can mean and how that can induce worry in a partnership. And so all of that comes into play as well. And so there's a whole lot of inner dialogue that people have with themselves that compound this stress, and how they navigate through the various, perhaps intimate relations in their life, or how they deal with something and go and show up to work why they want to scratch off their vulva, or like there's all of these sort of things that are occurring as well. And compounding that, and we found this in my research, was that in recurrent thrush, for example, because there is a whole lot of people where their tendency to recurrent infection is not well managed, there's also a whole lot of stress that's associated with encounters with healthcare professionals, in being perhaps dismissed, or not having further investigations done, or being offered the same treatment over and over again when that hasn't worked for them, and they're back here the month later with the same symptoms popping up again. And so that stress is pretty significant. And I think one of the biggest roles as a holistic clinician is just listening and understanding and giving feedback that, hey, I realize this is challenging, and we're going to find and look for solutions so that we can break that cycle of recurrency for you. And that's quite impactful, even just to have that discussion and listen.
In terms of treatment that doesn't seem to be working for people, what are your thoughts on Canesten cream?
Yeah, I mean, I think there's different ways to view treatment. The more I work in this space, the more accepting I am of having acute symptom resolution on hand. And so the use of Canesten cream can be that, particularly with recurrent thrush, if you've got a significant flare and there's a lot of inflammation and perhaps discharge, which is not always characteristic in recurrent thrush. If you need to use Canesten cream to get you through your weekend, it's completely okay. The way I view these things is that we know with that class of medication, whether called azoles, whether you're using them topically or whether you're taking them orally, like fluconazole, is that in recurrent thrush, there's up to a 50% relapse associated with it. So people go on, well, particularly if you've used extended courses, 50% of people go on to have a relapse of their symptoms. And so in that 50% of the population, it's not curative. It just is symptomatic treatment. And so it has a role in symptomatic treatment because sometimes the holistic interventions are not fast enough to acting, to get you out of a bind. And so in my practice, we work on prevention, how can we hold your microbiome so you don't spiral into that flare at that point in your cycle. But if you have symptoms, here are some options, and so in that perspective, I don't have any negative opinions around clotrimazole, Canesten cream. I think that you need to examine if you're using it frequently and continuously, then that you need better solutions than that. And there is a subgroup of people who, from the use of intravaginal creams in particular, will become hypersensitized in that you create more vulval inflammation from their use. And so then it becomes very hard to determine what is microbial, what could be thrush, and what is actually the fact that you've had this reaction to having this cream in place for such a period of time. And so, having people look at that and explore that, or going to see a specialist, they're all really important things as well.
Okay, interesting. And is there any other natural alternatives that they could use instead of the Canesten cream that you could recommend?
It's tricky because, again, it very much, like in the example of thrush, it comes down to the reason why you have the thrush, because we have the people that are hypersensitive, we have the people that have had a bacterial shift, we have the people that have had a pH challenge. And so in terms of people that have had a bacterial shift, using intravaginal probiotics may be very impactful for you. If your bacterial microbiome is fine, you won't necessarily get that same relief and response. And so it's tricky and very individualized. There are definitely things out there, it's more accessible to purchase boric acid and things like that. But again, it's about how frequently are you using them and what sort of cure are they providing you with, and you need to dig deeper with it as well. But yeah, it can be the whole range of different things, I guess, from, sitting in sitz baths with vinegars and green teas and things like that. But is it fast enough? Is it going to give you symptom relief? And how frequently are you having to resort to that?
And for diagnosis, would you recommend doing a vaginal microbiome for clients?
I use vaginal microbiome testing a lot. I think, though, if you've never had a standard swab culture STI screen, that's your first stop. You need to go there and have a look at that, because that will give you very basic insight in a very quick time frame, for very low cost in the majority of situations. And then for me, when I'm working with people with recurrency, understanding the bigger environment is very important, because potentially there is a resistant bacterial or fungal species sitting there that's causing the disorder, or there is an atypical bacteria in the background like ureaplasma or mycoplasma that needs to be removed before you can restore balance in that environment. And so that's where microbiome testing is helpful. I think that it needs to be used with an understanding of symptoms, though, because recognition of patterns of bacteria on a page only makes sense when you understand what the experience is in terms of symptoms and the timing, etc. Whereas there's patterns that look like they're healthy, and then they, for some people, may be the driver of their symptoms, and vice versa. You can have a non-lactobacillus dominated vaginal microbiome and be healthy. There's about 25% of the population that's their baseline of health, is not to have lactobacillus in their vagina. And so if you're just looking at microbes on the page and then making conclusions from that, there's a whole lot of risk and error associated with that. Whereas sitting down, and that's why I would say connect to somebody that can work with that, then they can understand your case and advise you on when to test. In my opinion, you need to do a vaginal microbiome test when you have the symptoms that are most annoying you, so we can understand what happens in the disorder of that, and understand where you were in a cycle if you have a menstrual cycle. So yeah, it's a useful tool. It's still very much, it's obviously not standard diagnostic. It's digging in that world of research, but it does provide nuance that you can match with an intervention. So for me, clinically, we use very targeted intravaginal herbal creams, or we might use quite specific herbal applications in different ways, or nutrient applications in creams and things like that. So that is what microbiome testing can reveal. Like, oh, you need this, and this is going to be the best intervention. But if I understand as well how much inflammation somebody has and how swollen their labia is and all of those other things, then I can also recommend something that will be soothing and delivering those particular things. Whereas, putting an acid, even if there is a pH disruption, putting an acid into a space that has a lot of inflammation and burning is not a great idea.
Exacerbate the area even more. Yes. Okay, great. That's been really wonderful having you here to talk to you and share your knowledge. Thank you very much. Is there anywhere that, because I know you have a university for practitioners to go and learn more about the vaginal microbiome, is there anything out there for the general population if they wanted to learn more about what's happening to their body?
Yeah, so I have social media, so particularly my Instagram, which is Intimate Ecology. There's a lot of general posts that I put out there, which are accessible for everybody. So we have some very specific questions that we answer, and also deep dive into quite specific bacteria or fungal species and what that might mean. So it's suitable for practitioners and members of the public. There have been some public-based education. The majority of my education is about educating practitioners so that we can help more people with more knowledge. But I do have some direct-to-public courses around some things. So there is a recurrent thrush webinar that we ran recently with my practitioners, and I will make sure that's up on the page. And there's also a webinar on cytolytic vaginosis and disorders of lactobacillus overgrowth, which is something that I get a lot of inquiries around, and it's very misunderstood. So we have a webinar on that as well. So all of those you can link through from social media or from the website and have a look at them.
Amazing. Great. Okay. Thank you so much for coming on today. And I'll pop your Instagram details for everybody to have a look at. Is there anything that you wanted to share with us that you think we all need to know about the vagina?
Oh, only that it's pretty amazing. And I think that there's a tendency, if you start to learn about the microbiome, to be very fearful. And I think that if you let go of that fear and understand that these are just, little microbes that we can very much influence and manipulate in different ways, it becomes less scary. So you're not a particular microbe, you are just the host for different imbalances. And I'm always cautious, even when I talk about sex, that, I want people to have sex, obviously. I just want them to be very aware around challenges and responding to challenges in that. So it's not, I think sometimes when I talk, it becomes very scary, and I don't want that to be the case at all, but it is about looking after it. It's a very important part of your anatomy and very integrated into your whole body, and deserves to be looked after and responded to if it's telling you it's not happy and healthy.
Absolutely. I guess just like you drew the correlation between aging, we all take such good care of our skin because we don't want to age. It's just like another part of the body. You have to be responsible for it to get the results that you want long term. Yeah, amazing. Thanks so much, Moira.
Thanks for having me.